Welcome back to Vital Signs. We are going to switch gears and talk about infertility with our resident fertility expert, Jessica Preston of DeNova. Welcome to the studio.
Thank you for having me back, Jen.
I'm really excited because you are wearing blue. We have talked a lot about the ladies in your segments. Let's talk about the male factor in infertility.
Okay.
Ooh, what are some of the common causes of male infertility?
So male factor infertility now contributes to up to 40% of fertility issues.
Wait, hold on. Did you hear that? 40% of fertility issues are not on us, ladies. It's a male factor.
Yes,
Sorry, I wanted to stress that.
No, it's okay. Well, except I do want to once again stress that it doesn't mean we don't have a female factor in addition. So we do see that male factor can attribute to up to 40%. So a lot of that is associated with low sperm count. So when we're looking at a semen analysis and we're looking at a sperm count, we're looking at a certain number. We're looking at, do they swim well, and do they have a certain shape to them? And so it's all of these different factors that tell us whether or not there is a good sperm count.
And so,
or a semen analysis.
Prior, in our last episode, I believe, or maybe two ago, we talked about structural versus hormonal.
Yes.
How much of that is structural versus hormonal versus, we don't know?
we actually don't know. So I actually looked for that for us to have that conversation. And when we talk about male factor, a lot of it is vague of, we think that it is likely contributed to, or attributed to these issues. So structural, like varicocele, which is like a varicose vein inside of the testicles, that can be an issue, but a lot of it is hormonal imbalance. So a lot of it is a low testosterone issue or a hormonal imbalance otherwise, or other medical issues that are happening with a person who it's there, if you're a diabetic or if you have metabolic disorder or cardiac disease. So we can see that. Medications is another cause. So when we're on certain medications, that can also impact fertility as well.
And so when we talk about all of these things, how can lifestyle impact the male factor in infertility?
Enormously. So when it comes to structural, this is a conventional medicine space. We need to go to our conventional medicine, to go to urology, go to our IVF specialist or our OBGYN who can refer us to an appropriate urologist. Not all urologists work in fertility, so you want to make sure you're going to one that specializes. And if you're finding one on your own, you just ask when you call, and you can go to a specialist who works in structural.
So hold up, what do you ask? Because this is a hard thing for people to talk about, especially men. Men don't like to talk about this at all. They don't. It's got shame associated with it. They should be performing, etc. So what is the question that they need to be asking the urologist, for example, when they find that there might be a male component to this?
So just so they know, you can have your wife call for you. This is.
Wait, hold on. Isn't that getting off easy?
Do we want to have a baby or not? Do we want to have a baby or not?
Okay.
So, basically, if you're shy about calling, and if the female partner has already been worked up, or they want a baby, or you've been trying for a while, and the presumption is that it is male factor, then you need to make a call, or she can make the call. And so what you're going to do is you're going to call and say, if you're the man, you're going to say, my wife and I are trying to get pregnant. We think that there might be that I might be the problem. That's easy enough. Or that some words are hard, right? So it's difficult to say, my semen analysis is abnormal. But your partner, your female partner in the OBGYN space, probably already ordered the semen analysis, so you probably already have it. So you can say, I have a semen analysis, it's abnormal. I was told to call you. Can you help me? Do you work with fertility? Do you work with infertility? You can use either word, fertility or infertility is perfectly fine. You'll know right away because they'll say, yes, we do. Dr. So-and-so is our resident specialist on that, and so we're going to set you up with them, get in with them. If they say, oh, well, we dabble in it a little, ask them. You can even ask the office you call, do you have someone that that specializes in this area? Mm-hmm. So I'm in Michigan. I know that the Michigan Institute for Urology has a lot of specialists that work in that area of infertility. But look and see where there might be someone who's really got an interest in that space.
Yeah, not the dabbler. That's what I heard. Not the dabbler.
No, because when it comes to a semen analysis, and even a normal semen analysis, If there are issues with fertility, such as multiple miscarriages or a failed IUI, intrauterine insemination, where we inject the sperm up into the uterus itself so it gets a little boost, or an IVF in vitro fertilization, which is done through REI, the IVF specialists. If that fails, there is another test called DNA fragmentation that can be performed on a semen analysis, even if it appears somewhat normal, where it looks at the DNA, the genetics of the semen analysis itself, of the sperm themselves, to see is there something that is on a genetic level there.
Holy cow, that's a whole lot.
It's a lot.
That's a whole lot, and I know it's a hard topic to talk about. So what treatments are available if they do have a male fertility issue?
So if it comes to a structural issue, there's controversy as to whether or not surgery really helps, and it depends on the grade. So you hear about grades in medicine, just call it mild, moderate, severe. Sometimes we call it stages of 1, 2, 3. So mild, moderate, severe. If something is mild, then we're on the fence. Like a varicocele, mild varicocele, it's on the fence. Is it going to be helpful or not? For one that is more severe, it may be the only option. Even if it's not going to be as helpful, it might be our only option that we have. Now, when it comes to those interventions, there are also some medications. So there's a medication called Clomid, or clomiphene citrate. This is something that we give women to help them ovulate when they're not ovulating regularly. We're finding that actually, when we give it to men, can actually help their semen analysis. So there are some medications out there that we're finding to be very helpful as well at this point. From the functional medicine aspect, we are going right back to those lifestyle factors. If you think about it, if our testosterone is low, we're going to say in the functional medicine space, why is it low? We're not in conventional medicine, we say testosterone is low, here's your supplement. Functional medicine, we say, why is it low and how can we help your body naturally produce more? And then we go down that path.
And we talk about lifestyle.
We talk about
and
lifestyle.
Sleep and nutrition and stress management, all the things.
We do, that's for sure. Yes, we do.
Okay, fantastic. And so, like, if there's a female out there and she has been doing all the things and she wants to bring the topic of male infertility or potential male factor into the conversation, how can she do that?
With her husband, you mean, or a partner?
Yes.
Oh, kindly, and not when they walk in the door. So,
hi, honey, how are you? Are you infertile?
Yeah, standing by the door. So, but I think we've talked before about how to enter a conversation and knowing that we're both vulnerable. Both partners are vulnerable, especially in a space like infertility where we can point fingers at each other and say, this is your fault. And it's a real sticky topic when we go there. So sitting down and saying, this is how I feel. Do you have a moment? Are you open to a conversation? This is where things are for me in getting tested, and say where things are, because we bring it to them after our doctor's appointments. I found out I'm not ovulating. It's recommended that you get a semen analysis to make sure everything is normal there before we move forward with any other testing that can be invasive on my part. Would you be open to doing that?
That was an awesome way of doing this. I know, because these people are they're listening, and there's the question that everybody has is, how do I bring this up?
Yeah.
It's a sticky topic. It's horrible. I don't want to think about it myself. I don't want to talk about it myself. Yeah. How do I bring it up with my partner?
And I'll tell you, I actually just wrote a chapter for a book about my infertility journey, and exactly how I asked my husband to do this, I put in that chapter. It's so interesting that we are talking about this. So basically, it is hard. It's very challenging, and the feeling that we can have as women is he's going to say no. He's going to say no, and we get very sad about that. So as women, we have to know that we're really worthy and deserving of our partner doing their part so that we can make this beautiful family together.
Oh, that's so fantastic. I can't wait to hear about this. Share more about your book.
Oh my goodness, it's A Holistic Mental Health Volume 2 by Laura Mazzata. It will be available in April, and I have one chapter it's the only chapter on infertility, and it's basically, empowered surrender, love, and relationships, your path to fertility. And so it's short. It was my journey. We have some tidbits in there. The authors of this book, everybody has a chapter in there for different areas of holistic mental health. and it's going to be a really remarkable production.
Fantastic. And you guys heard it here first, so be definitely looking for that. I'm sure Jessica will have that on her social media. So Jessica, while we're on that topic, how can people who are watching, who are like, oh, okay, I need to learn more about this male infertility thing, or they're on a journey and want to get in touch with you, how can they reach out to you?
Thank you. So we are denovofertility.com, and we're on all major social media as well. So we are De Novo Fertility Community on Facebook, and on TikTok and Instagram, we are De Novo Fertility. If you want to speak with one of us, you can go to our website and sign up for a phone call, and you'll get one of us that would work directly with you. We are a team approach, so we all work together with you as a couple to make sure that you can achieve these milestones and achieve that family of your dreams.
Thank you so much for joining us, for bringing such amazing information to our audience. It was an absolute pleasure to have you back here today.
Thank you so much, Jen. Always a pleasure.
Absolutely. Sounds like it's time for you to make sure that you are taking action, and definitely reach out to Jessica if you have any questions, or if you're on a journey or looking to start that family, or having struggles with starting that family. She is an expert in her space. She's a tremendous resource for you. We do have to take a brief break, but we will be right back after these messages.